Okay, this video is called Are Nobel Prizes Fake? And the reason why I say are Nobel Prizes fake is because if you read a medical textbook, what you're going to be surprised to find out, one of the many things, is that most of the people who did the best research, they're not in the book, and they'll never be in the book. Walter Kempner, he was the first pioneer that was curing hypertension, curing kidney failure, saving people's lives. There was no dialysis back in those days. He's not in any of the medical textbooks. I've never seen his name in a medical textbook, and I've gone through tons of them. Okay, Dennis Burkitt, abdominal pressure syndrome. You'll see his name in a medical textbook for his work with the Burkitt's lymphoma, but nothing about abdominal pressure syndrome. I've never met a doctor who's heard of abdominal pressure syndrome. I know a lot of surgeons I told they didn't know about abdominal pressure syndrome. It's not known. As soon as you say abdominal pressure syndrome, they start thinking about things like ICU patients. Should we put a Foley in the urinary bladder to measure the pressure? That's abdominal compartment syndrome. It's a totally different thing. It's an acute problem. Abdominal pressure syndrome obviously is a chronic problem from constipation. It's not in any of the books. Okay? And I even remember when I was a resident, there was a world famous gastroenterology, gastrointestinal radiology attending. And there was a paper about something that kind of vaguely reminded me of abdominal pressure syndrome. He goes, this is ridiculous, okay? And that was sort of what was taught to the residents. Okay, Roy Swank and John McDougall did tremendous work with autoimmune disease. They'll never be in a book. Leaky gut isn't even in the chapters on autoimmune disease in the big, Ivy League medical pathology books, okay? Dean Ornish, he did, top-notch research in both coronary artery disease prevention, reversal, as well as in prostate cancer, low-grade prostate cancer. He's not in any of the books, okay? Richard Moore, he's a guy that did the fantastic research with the plasma membrane potassium sodium pumps, okay, to maintain the sodium electrochemical gradient that is related to metabolism of calcium. The ability to pump calcium out of the cell depends on a healthy sodium electrochemical gradient. He's the one who did most of the work to figure that out, and he wrote that high blood pressure solution book. He's not in any of he'll never get a Nobel Prize. The point, why is this even worth talking about? Because what I'm saying is, in order to become smart at understanding medical disease, at reading scientific papers, at judging what is true and what's not true, is you have to recognize there's a tremendous amount of information that's being hidden from you, especially all this information about diet and toxicology. The reason is there's no money in it. Nobody makes money off you if you're empowered to know this stuff. Okay, and once you get that, you can think a lot more intelligently about what is true and what is not true. Because that just quite often is the case. Like people say, oh, to understand research, you need to understand statistics. That's nowhere near as important as understanding who funds the paper, who has an incentive in this paper, why was this paper written, okay? Caldwell Esselstyn, pioneer coronary artery disease reversal and prevention, he's not in any of the books. All these guys deserve Nobel Prizes, and probably none of them will ever get it. And the reason they'll not get it is because they don't want publicity going to this type of research on diet and toxicology. Okay, Michael Brownlee wrote this beautiful paper, an academic orgasm, about the causative mechanism of type 2 diabetes being especially, fat, especially saturated fat. This paper is just beautiful. As you read this paper, you're just like, what a genius. This is so eloquent. So it's just awesome, his paper. Okay, one of my favorite papers I ever read in my life, Unifying Theory of Diabetes Complications. Okay, Gerald Shulman, brilliant guy, Yale guy, MD, PhD, and he did the research with nuclear magnetic resonance spectroscopy to show that accumulation of fat within skeletal muscle was the first detectable finding in insulin resistance. Okay, it's just an absolutely brilliant paper. He's got a YouTube lecture. Brownlee, you can see Brownlee's lecture if you go to American Diabetic Association, but you got to sign in to see it. You can see the paper for free, but you can't see him lecturing unless you sign in. Esselstyn, tons of lectures online. Richard Moore, he doesn't have any lectures online, but you can get his book, High Blood Pressure Solution. Dr. Ornish has lots of lectures online. Dr. Swank has a couple lectures online through Dr. Ornish's site, and of course Dr. McDougall's got a lot of lectures on site. Burkitt's being interviewed by McDougall. Walter Kempner, you can't see him lecturing, but you can read his biography. You can see lectures about him. Including at my site, Dr. McDougall's site, for example. Gerald Shulman, like I said, he's got his own lecture. Thomas Seyfried, he's a little newer guy, but he did some pretty good work with the metabolic theory of cancer. I don't agree with him about his ketogenic diet ideas, but he did great work with metabolic theory of cancer and the Otto Warburg, metabolic theory of cancer. So anyways, I'm just showing you that the guys who actually did the best work, because it's related to diet and toxicology, it never gets into the books. It's not even mentioned in the books. I have never even seen a footnote to these guys in the books, okay? And that tells you something when this is like the most important stuff in these areas, all right? And that also tells you why, unless the issue of diet and toxicology has been addressed for a chronic disease, it really hasn't been covered.